Welcome to this week's edition of What the Wednesday. I'm Sally Balmain with the Northwest Local Land Services Ag Team, and I've got a special guest with me today, Sean Slattery, who's our district vet based in Narrabri.
That's correct, yes.
But a lot of your work, Sean, is west of the Newell.
Yes, yeah. So there's Megan Davies and Justine McNally who also cover that area. We've been seeing a lot of animal health issues now and in the last 18 months, which are drought related, especially west of the Newell.
Yep. So I guess those guys have been in drought probably for the longest.
Yes, unfortunately, some people, they're well over 2 years where they've been feeding, for the vast majority of that 2 years and feeding grain and destocking at the same time.
Yeah. So I guess most people by now have a bit of a handle on feeding. But what's some of the stuff that you have sort of seen just perpetually popping up as a result of these long-term feeding?
The first thing we're seeing is we're seeing vitamin A, we're seeing lambing ewes with hypocalcemia, and we're seeing urolithiasis or water belly in feedlot lambs.
Yeah, and so for those guys who think maybe they are seeing some of that in their flocks, what's your advice to them?
Okay, so with the vitamin A, we've really been seeing that for almost 18 months or 2 years. Vitamin A deficiency produces a variety of signs, and I think really why we're seeing that we're into uncharted territory. No one has fed animals this long in a drought, and it's due to a whole stack of factors. But trouble with vitamin A deficiency is often the first sign is just ill thrift. They look like drought affected animals, so they can creep up on you quite easily. In weaners, cattle weaners, they're very ill thrifty. They have a rough coat. And they show some stunting. So generally people are ringing us up and saying they're not growing as well as they should. In adult cattle, we've seen adult cattle that haven't got lice but are losing great patches of hair. That's another sign we've seen. In the sheep, we've again seen ill thrift in lambs. Poddy lambs are particularly affected. So if you have a problem with poddy lambs, that's something that may indicate you've got an overall problem. We've had it associated with mastitis in lambing ewes. Something we've seen a couple of cases of is in feedlots is eye problems. They're prone to eye infections, but also they'll just have a lot of eye weeping just due to the vitamin A deficiency. And in all species, the first sign they say is what they call night blindness, which means if you're moving stock around twilight, which very few people are, so we miss it, they will tend to run into gates and posts and things like that. Yeah. So they're the great variety of signs we're seeing with it. Generally, if people, I don't think there'd be a flock out there or herd out there from our testing that if they haven't given a vitamin A injection, wouldn't need one.
Yep. So. Yep. And best course of treatment is to give the shots, do you think?
Yeah. Look, give vitamin A drop. If you've got doubt, seek veterinary advice. But look, it's a simple injection. Compared to the feed we're putting down their throats, it's relatively cheap. You follow the label and the amount to give. Some are into the muscle, some are under the skin. Just follow the label. Just one warning, and particularly with young animals, is that if you inject over the shoulder area, they will be quite sore and sorry and lame for the day or a couple of days. And look, that will happen. But usually they get over it very, very quickly. So just follow directions. Try to get away from the leg muscles when you're injecting. In terms of how often you need it, they talk in the literature about being more than 6 months off green feed. We're seeing some cases which suggest that maybe the period is shorter. But the label says 6 months. So look, if you've already done it, seek veterinary advice on when to do it again. Particularly important if you've got pregnant animals, that they should be done, because that is the only way we'll get vitamin A into the newborn animals, and then you can do them at marking and mulesing or weaning and so on. So that's vitamin A.
Yep. So what about some of these calcium issues?
Okay, rightio. As you've probably talked about, this all goes back to the need to include lime as part of the grain ration, because grain is very high in phosphorus, and of course that includes pellets or any grain-based ration. In simple terms, because there's so much phosphorus, it drags the calcium out of the animal. It's oversimplifying it a little bit because they're made of calcium with their bones, but with the lambing ewe, which has got high calcium demands because they're growing the bones in the fetus, and they're starting to produce milk. Prior to lambing, can occasionally be at lambing or after, but just prior to lambing, they'll become recumbent. Sometimes they'll show a few shakes and tremors, but it's really difficult condition to differentiate from the other one we sometimes see with drought, which is pregnancy toxemia, which is due to an acute lack of feed at that period. So the hypocalcemia is due to not having enough lime in the feed. The pregnancy toxemia is due to not having enough feed. So that's why it's really important if you do have sheep go down around that lambing period to seek veterinary advice on what it is. And look, a lot of people, especially with sheep, are using self-feeders, and there are problems with putting lime into self-feeders. There are a number of alternatives. The very best alternative, which a number of people are doing, is mixing a slurry out of the lime and putting that in at the 1.5% rate as it goes in. The other option a lot of people are successfully using is lime and salt licks. 50-50 start, but most places it works very well, but there are some places where it doesn't, or a portion of animals don't get it. So, and if we do get a hypocalcemia outbreak, they're the sort of things we go to. There's also the calcium injection bladders under the skin, which are used as a treatment. But as I said, if your sheep are going down around that lambing period, please seek a veterinary investigation.
Yeah, definitely. And I think there was a video posted the other day on the Facebook about how to add the lime slurry to grain.
That's
it was really clever.
And that was from a Walgett landholder who was very keen to promote this. Yeah. So, urolithiasis or water belly or bladder stones. We're seeing a couple of cases of this in feedlot lambs, including lambs on pellets. Okay. Now this actually again is due to the imbalance of calcium and phosphorus in grain rations. But this time what's happening, because there's an excess of phosphorus coming out in the urine, crystals often form. In winter where the sheep aren't, or the lambs on feedlots aren't drinking that much water, that urine sitting in the bladder has time for crystals to start to form. They're often not big, they're more like sludge. One key will be there's the classical signs of animals straining. It's only the wethers that are affected. So we've had people ring up and say, look, I've had so many die, and they're only the wethers. That's what the issue is. In terms of treatment, it's very difficult, near impossible to treat once you see cases. It's called water belly because it's what often happens besides the straining. They actually get a complete blockage or partial blockage, and the urine actually forces open the penis, and it spreads in the subcutaneous tissue below the belly, and it's called water belly. So it's quite a painful condition. Once they've got it, it's very difficult to treat. Generally, if you're looking at treatment, we're more or less you just take them out of the feed and you try to put them on lush feed. Going back to prevention, how do we handle? Well, again, it's straight back to getting enough lime in the ration. Again, I talked about adding it as it's going in. With pellets, it can get really difficult. And again, I've had people who've had pellets who've been putting out the lime, the salt licks, but not all lambs pick it up. So some people have experimented with adding a little bit of lime with the pellets, but you have problems with clogging out the feeder. But it really becomes, you've got to figure out how to get that right amount of lime in. If you've got cases, some people are concerned it may be the water or things like that, we can send the crystals off for analysis. And we can also, if you're concerned about what the ration you're getting, we can send that off for analysis as well. So they're the conditions. We saw them last winter. We're already unfortunately seeing them again. They're preventable. And as I said, if you've got any questions, please contact LLS.
Awesome. So there are district vets located across the state, not just in the Northwest LLS, but across all regions. So reach out to your closest LLS office to be put in touch with somebody that'll be able to help you out. Thanks very much, Sean.
Thank you, Sally.